Hi all, welcome to our channel Toxicology on Board. In this video, we'll be going through question number 3 about phenol poisoning. The major life-threatening effect following poisoning with phenol is. This is a typical structure of a phenol, a benzene ring with OH group. Option 1 is optic neuritis with permanent blindness. Here you can see optic neuritis can be seen. Severe gastrointestinal irritation, esophageal stricture. Here you can see this is the esophagus, then your uh, stomach is starting from here, and this is the stricture you can see, narrowing of the esophagus tract. Fatty degeneration of the liver. Various types of liver toxicity are there. In the case of degeneration, fatty depositions will be seen in the liver, throughout the liver. Option E is respiratory depression. Let us see what is the right answer. The right answer is option E, respiratory depression. The question was major life threatening effect with the phenol poisoning. Let us learn what is phenol poisoning in this video. Phenol, carbolic acid, also known as phenolic acid, benzenol, as I said, benzene structure with an OH group, is an aromatic organic compound. Essential for production of polycarbonates, epoxides, explosives, bakelite, nylon, detergents, herbicides, phenoxyherbicides, and numerous pharmaceutical drugs. So you can here clearly see in the preparation of our pharmaceutical drugs, phenol is used one of the key reagent. Used as an antiseptic and in the production of carbolic soap. Used for permanent treatment of ingrown toe and fingernails. Please go and read what is ingrown toe and fingernails. So this particular phenol, it is used for ingrown toe as well as fingertails. This particular procedure is called matrixectomy. During the Second World War, the toxic effect of phenol on the central nervous system causes sudden collapse and loss of consciousness in both humans as well as animals. A state of cramping precedes these symptoms because of the motor activity controlled by the central nervous system. So main point is phenol able to cross the blood-brain barrier, reaches the central nervous system, and it is causing sudden collapse as well loss of consciousness, both in humans as well as in the case of animals. Injections of phenol were used as a means of individual execution by Nazi Germany during the Second World War. As you have learnt in the video 2 also, with respect to leucite, which was a arsenic chemical warfare agents. So there were many chemical poisons which were produced during the Second or First World War. So similarly, phenol also had some applications during Second World War. Particularly, it was used by Nazi militants. Okay, individual execution के लिए for mass murdering, these injections of phenol were also used. It was originally used by the Nazis in 1939 as a part of a mass murder of disabled people under Echelon T4. Please go back and read what is Echelon Echelon T4. This is a famous incident in which phenol poisoning was there, and there was a mass murder of disabled people during this. Coming to phenol toxicity, phenol is a corrosive, toxic substance that can cause a variety of health effects. What are those health effects? We'll see. One is local effects. Phenol can irritate the eyes, nose, throat, and causes skin burns. Coming to systemic effects, phenol can cause systemic poisoning through inhalation, skin contact, eye contact, or ingestion. Means there is inhalation exposure, dermal exposure, as well as oral exposure. Symptoms include, with respect to systemic effect, systemic toxicity is CNS stimulation. Earlier we have seen CNS system, following by CNS depression. That is the reason we have sudden collapse and loss of consciousness. Coma as well as seizures. As you can see, here it is given cramping precedes the symptoms caused by motor activity. Nausea, vomiting, diarrhea, methemoglobinemia, hemolytic anemia, profuse sweating, hypotension, decrease in blood pressure, erythema, irregular heart beatings, pulmonary edema because it is also exposed through inhalation, and tachycardia, increase in the heart rate. Phenol also has developmental as well as reproductive toxicity. Let us learn how it is causing and what are the developmental reproductive toxicity of phenol. Prenatal exposure, okay, before the baby is born, to phenol can reduce fetal weight and viability. So there will be a decrease in the fetus weight and decrease in the survival rate of the fetus. Okay, increase of the risk of neurological symptoms. Similarly, in the adults also you have seen that there is a CNS depression, right? Neurological symptoms are there. Phenol is a protoplasmic poison. Means if you look at a cell, typical cell structure, you will have nucleus, cytoplasma, protoplasma. So it is going and affecting protoplasma in the cells, protoplasmic poison that can break through cellular membranes. It will rupture the cell layer, okay, denaturing proteins and causing cell death and necrosis. So there is direct necrosis of the cell is taking place. Damage to the nervous system is the primary cause of death from the phenol poisoning. So that we have learnt about the phenol poisoning. The main thing we have learnt is how it is causing CNS toxicity, routes of exposure. We have learnt about its use during Second World War, as well as we have learnt about reproductive toxicity. Thank you for watching the video. Be curious. All the best for your toxicology exam. If you have any questions, please comment, like, subscribe, and follow my YouTube channel. Thank you.